So there are several principles or properties of outcome selection that have been suggested, and all have similar considerations to the ones that I've just discussed. There is a paper that was published recently in the Current Opinions of Critical Care in 2008 that lists 6 principles for choosing a clinical trial outcome. Your intervention should plausibly change the primary outcome. The primary outcome should be cared about by your audience, and the primary outcome should be relevant to patients. So that's the meaningfulness. The primary outcome should be measured efficiently. It shouldn't be an arduous thing to measure. The primary outcome should be measured reliably. Again, repeatable, sensitive, specific, and is with as little bias and error as possible. When possible, use a well-understood continuous scale. This is really key. If you can capture information in a continuous manner, you can always dichotomize, trichotomize, or group it later. But if it's only captured in groups, you cannot ungroup it to do some kind of continuous statistical assessment. So don't simply check that someone has high blood pressure, capture their blood pressure measure if possible. Then you can look at their blood pressure measures over time and determine if they have resistant hypertension. In summary, when you begin to think about the outcome you'll use to assess your question, make sure you start with a clearly specified question. Relate your outcome to the question at hand. Consider the relationship between the outcome and the intervention. Make sure the outcome is measurable in a repeatable manner. And then select the best outcome to answer the question at hand.